Do you want me to watch you or help you? Or
Will you
How the sim would be.
So do you want me to go in there?
Yeah.
Okay.
Like that's how I want to do it.
when you do it with me, can you actually go with me while I do it? Kind of pretty much exactly how you did it, except
Okay.
I go through it with you.
Yeah.
Okay.
Yeah, I want it to have like the sim, but like
The sim.
make comments,
Okay.
things that I'm not doing or
Gotcha.
could be doing.
Yep. I can do that. Okay, that's fine.
But I don't think I have enough room on my phone.
Tordal.
I can always record it on my
Tortilla.
laptop too.
Change it to tortilla. Tortilla.
Okay. All right. Yeah. Okay.
Okay.
All right. So
We'll figure out the spellings.
She's gonna get a front row.
that's okay.
Right.
All right. So you start by knocking on the door, right? And you go in and hand hygiene. Yep. And then you shut the curtain. I'm not gonna forget it this time. So you close that,
Yep.
and then hand hygiene.
Even if I want Preston to come up next Friday.
And then you introduce yourself. So I would say, "Hi, my name is Olivia. I'm going to be your nurse today." And then you ask them for their name and date of birth, right?
Yes.
Okay. So then I would check the wristband for their name and date of birth. Okay. And then after that, I would ask them how they're feeling. Oh, allergies. Yeah. Okay. So I would ask them their allergies and how they're feeling. And then after I do that, I start with the vital. I would already have the vital signs, but I would talk to them about their vital signs.
Acknowledge them. Yep.
Okay. So then after I acknowledge their vital signs, and I'll record that after the sim is done out there, then I would do, I just want to log into DocuCard first. Then I would do pain assessment first.
You can ask them how they're feeling, and
Mhm.
they'll probably say I'm having pain.
Okay.
So, yep.
Okay. Is this the Simmons Robin?
Yep. That's it.
Okay.
Oh, and remember to scan. As soon as you open that chart up, remember to scan. No, on the there you go.
Okay.
Perfect. Or it won't work.
Okay. And you said we can pull this up, right?
Yep. You can go into assessment and then look at pain scale. And then it should say
There's two. There's right
report
foot.
new pain assessment.
Okay.
But I'll have it specific because I'm gonna
Okay. Do we have to have this up while we do it, or if
No.
I know old cards?
If you
Can I
know,
just?
sure.
Because I feel like if
Yeah.
I try to do this, it's just gonna take me longer.
That's okay.
So then
I just
would,
wanted to let you guys know that you can, but
Okay.
you do not have to.
Okay. So then I would ask them old card side. Ask them when it started, where they're feeling the pain at, how long the pain lasts for, what type of pain it is. So whether it's throbbing, sharp, dull. Shoot. Aggravating factors, right? So what
Mhm.
makes it worse?
That makes it
And
better.
then relieving factors, what makes it better, and then if they've done anything to try to treat their pain. Or
And you don't really have to do that because
Okay.
we know they're in the hospital. So if you don't want
Right.
to do the entire old cards,
okay,
you can ask them just alleviating,
Okay.
aggravating,
okay,
and then what does it feel like,
okay,
and then
Alright.
ask them to rate it.
okay, cool. All right, so then after they rate it on a scale from 1 to 10, then I would do the wound assessment.
Yeah. Yep. You're gonna
Okay.
want to look at where they're having pain. Yep.
Okay, so then I would assess. I would just tell. Is it? And I have another question too. Are we gonna? Is Dr. Hunsberger gonna be in here again, or is it just you?
Just me.
Okay, so then I would basically just say I'm looking for signs of infection, like
But you
color.
would look at it.
Yeah. But then I would tell you that I'm looking for color, drainage, warmth, odor,
Mhm.
right? Okay.
Mhm. And tenderness.
And
around it.
tenderness.
Mhm.
Okay. All right. And then after I check them out, then I tell them I'm going to be giving them their morning medications, right?
Mhm.
Okay. So then
Yep.
I would do hand hygiene again, and then I'd come out here. Am I missing anything so far?
Not so far.
Okay, cool. So then I come out here, and then I'd shut the curtain again. Okay. I'm not going to shut the door. Okay. And then I would do all the medications, and I don't know. Then for insulin, it's shared to cloudy, shared to clear, shared to clear, shared to cloudy. Okay. Right, okay, alright, so good, yeah, we're good. Alyssa told me something that helped me remember. She said, think of it as a clear sandwich on cloudy bread. Cloudy, there It's easy to remember, so okay. So I would come back with the medicines and I'd knock on the door again. Close this darn curtain.
I know.
And then I'd wash my hands and then I'd ask them for their name and date of birth again, right?
Yes. Yes.
Okay. So then I would do that and then after that I would tell them I'm giving them their morning medications, right?
Mm-hmm.
And then, okay, so one of the things that I would appreciate if you went over with me is like what kinds of things I should say for teaching. I know you said, but can you like go over those again?
Yep. Bring up their MAR.
Okay. Just because I want to make sure that because that's something I missed points on last time also.
So, are you comfortable
Yeah,
with the MAR
yeah.
and giving them that? Okay.
Yes.
So, which one do you want to give first?
Let's just do insulin like you did.
Okay.
So,
Alright. So tell them that you have their morning insulin.
Okay.
You can say, I am giving you your Heliolin NPH. This is the one that you've been taking at home.
Okay.
This is your long-acting insulin.
Okay.
So this is going to stay in your system about 16 to 24 hours.
Okay.
Okay?
And then I'm good with this. Okay. So I'm not even gonna bother doing this because I know how to
As long
do
as
this.
you're comfortable
Yeah,
with it.
I am.
Okay.
Yeah.
And then you can tell them that because your blood sugar has been elevated since you've had this
An
infection, the physician has ordered some extra insulin for you in the hospital.
Okay.
This is a rapid acting insulin. You're ordered this before meals. It's going to take effect within about 26 to 30 minutes.
Okay.
Okay, so they're going to be taking it, so you're going to give it around mealtime, but their breakfast is going to be coming.
Okay.
You mixed it with their longer acting insulin since
Okay.
it's the same time.
So you're
They're
gonna give it to them
compatible.
in one dose is basically
Yep.
what you would. Okay.
Yep, and tell them, again, like I said, that it's a rapid acting insulin. So say if you start to feel dizzy, sweaty, shaky, please let me know.
Okay.
Okay?
Alright, okay. And then after that, I'm probably just gonna do it in the same order you did. So then I would give them their morphine, and to do that, I would take it over. And then what would you teach them about morphine?
With the morphine, tell them this is your pain medication.
Okay.
This is 2 milligrams. This is, I'm gonna be giving this to you through your IV. So it's gonna start to take effect pretty quickly. Probably within a few minutes, you should start feeling some relief of your pain. This might make you really sleepy.
Okay.
It can cause some facial flushing. It might make you a little bit nauseated. It might make you dizzy. If you're feeling any of those side effects, please let me know.
Okay. And then I would wipe this off with an
Yep.
alcohol pad and I would just inject it in here.
Mhm.
And I would say that I would inject it over 4 to 5 minutes, but you don't actually want us to stand here for 4 to 5 minutes, right? Okay. Good. Just checking. Okay. And then I would give them their antibiotic and I would tell them it's because they've acquired an infection in their wound.
That's why they're here. Yep. So they were put on an antibiotic to help with the infection. And then just give them some side effects of the antibiotic.
Okay. Alright. And that would
They can
depend on
look for-
whichever antibiotic with you. Okay. So then I would give them that like we did before.
Mm-hmm.
And then ask them if they wanted to get together or separate if there's more than one pill, right? And pretend to give them water. And then after that, ask them if they're feeling okay and if they need anything. And then if they say they're feeling fine, I'll tell them I'll be back to check on them. And I do hand hygiene, go out, and then close the curtain. And then you want us to just pretty much put the meds back on the cart and then just come right back
Come
in.
back in and ask them how they're feeling.
Okay. And that's everything?
Mm-hmm.
Okay. Awesome. Alright, I should be good then. Thank you.
You're welcome.
We're gonna get a new piece of paper, right, before we go in.